Guys, I've seen this scenario way too many times. You're getting through pregnancy, you're thinking, I'm doing great, things are going great, and then all of a sudden something happens, PIH, cholestasis, high blood pressure happens, and all of a sudden your provider says, you know, I think we should take the baby early. I think maybe you should have an induction. Now, it is a whole other bag of chips to go through the question of if you're having an induction, but if you ultimately decide that the induction is right for you, a lot of times I see people go in, they start the induction, it doesn't go so well, it's taking forever, maybe that person gets tired or maybe their baby gets tired and they ultimately end up having a C-section. And in my mind, I'm thinking there's gotta be something that we could do to help these people maybe prepare in advance. Is there anything we could be doing? And I started reading some studies on how we can prepare our cervix for labor, and I'm thinking of 4 different things that you can do to maybe help your cervix just in case you need to get induced or to help when you go into labor. So today I'm gonna review those 4 different things with you. In case we haven't met, hello, I'm Hillary, I'm the pregnancy nurse. I'm your bump to bassinet bestie who is going to prepare you for the birth that you end up having, not the birth that you're picturing perfect in your mind like everyone seems to want to talk about. This video is sponsored by the online prenatal class for couples. It truly is the way that you are going to get prepared for your upcoming birth. It is affordable, it is fast, it is taught by an expert. It even comes in at under $100, so I really recommend that you guys check it out. I think you're really gonna like it. Okay, so what are the 4 different things that you can do? Now, these you're going to start early. These are things you're going to start thinking about during your last few weeks of pregnancy. In fact, I would bring them up to your provider at around 34 weeks of pregnancy so you can discuss it with them. Now, if you are past that point in your pregnancy, I think these are still valid to take to your provider and say, hey, do you think I should start any of these? I'm not saying that you should do all of these different things. I would pick the ones that seem most likely for you. And one of the things I want to recommend is that if you start doing one of these things and you are absolutely hating it, I would 100% recommend stopping, because you can be stopping the flow of oxytocin for yourself. We don't want that. Part of labor is feeling relaxed and comfortable, and if you are just hating one of these things, switch to one of the other ones, or try a few in the beginning, see what you're liking, see what you're not liking, and then make it work for you. Okay, the first one is special time with your partner. Now, I hear this a lot of times on social media that this will kickstart you into labor. So I deep dove into the studies, and in reality, it's not shown to kickstart you into labor, most of the studies. However, the prostaglandins in the little swimmers that are deposited near your cervix can help it to soften, similar to other things that are in here. Now, a lot of the studies showed that people who were having this frequently in the last month or so of their pregnancy, I'm not saying you got to do it every night, I'm saying 2 to 3 times a week, that could help to soften your cervix. Some of the studies shows that it helps, some of it doesn't, but if it's something that you would enjoy or whatever, I think that it is a viable option to try and get that cervix ready for labor. Quick reminder, these things are not things that are going to kickstart you into labor. Personally, I don't think those exist. There is one thing out there that may kickstart you into labor that you can do at home. Obviously, you can come to the hospital. If you really want to go into labor, I would talk with your provider about possibly having an induction. But these things are meant to get your cervix ready, so when labor happens, maybe it's a little bit easier and maybe you're less likely to have a C-section is my ultimate hope. Okay, the second thing is pumping or stimulation of that area of your body. Now, a lot of people think this will kickstart you into labor, and I looked at the studies, that doesn't seem to be the case, but in a lot of the studies, they were encouraging people to do it from, 36 weeks of pregnancy, some of them hours a day. A lot of these studies are looking at people in third world countries who really they can't walk into a hospital and be induced. So if they need to get the baby out, say they're 42 weeks, what can they be doing at home? And this is obviously a viable option, because if you're just hand doing it, then you don't need electricity. It's something you can easily do at home. So could it start you into labor? No, but if you're doing it frequently ahead of baby being born, I would encourage you to check out the article so you can learn more about this. It might help get you into labor. And this is a quick reminder that these are things that you should not be doing, before 36 weeks of pregnancy. And obviously you should be reviewing them with your provider, because pumping actually could overstimulate your uterus, meaning the uterus contracts too hard or too long, which is not good for you or baby. So talk with your provider about things you should be thinking about when you're doing it and when to know that it's going awry and you need to stop. These are not things that you should be hiding from your provider. I don't think you should hide anything from your provider. If you decide to take castor oil, which I absolutely do not recommend, I think you should go into your provider and say, I know the risks and the benefits of castor oil, but I'm gonna give it a try. What should I watch for? So that they're at least on your knowledge train at that point in time. Okay, the third thing is evening primrose oil. Now, I had heard about this one quite a bit, and I had never looked at the studies. And I gotta tell you that the studies ultimately showed that it may help your cervix soften before labor. The most promising part of primrose oil was that in the study, it showed that people who took it had a shorter period of time towards when they delivered than people who didn't take it, which is ultimately what we're looking for. Now with primrose oil, there are some serious contraindications, including blood clotting disorders and any previous mental health concerns. So this is definitely one you're gonna wanna talk with your provider. Also, so there's some different ways to do dosing, although the studies showed that putting it in the birth canal was the most effective, but you're gonna wanna talk with your provider about what they recommend as far as the actual essential oil, which I haven't seen recommended very much, or like a little tablet. But primrose oil does show some promise. And one of the things I really appreciated in the studies is it showed some promise towards using primrose oil before like people get an IUD, which I think would be really great because a lot of people find the IUD extremely uncomfortable to get put in. So if we could open your cervix a little bit before the IUD, something like this could be very helpful in that instance as well. As a note, as I was going through a lot of these things, I find that providers and the medical establishment seems very reticent to recommend any of these things. Of course, providers are going to want to cover themselves legally. And so a lot of times they're not going to recommend that you do primrose oil, but they can give you some of the risks and the benefits, things to watch for, things like that. And they know that you're doing it. You do not have to have your provider's blessing because a lot of providers are not going to give it. What you're asking them for is if there's anything specifically contraindicated for you and what you should be watching for if you're going to try any of these methods. Okay, finally, the last thing is dates. Now, I'm not talking going out to a movie and dinner with your partner. I'm talking about the dried fruit. I think they've been used in the Middle East where dates are grown really frequently to get people to go into labor. And now the studies show that people who took dates, their cervix was more open when they went in for labor than those who didn't take dates. So ultimately, it's showing that your cervix is softening, it's preparing for labor, it's probably just a little bit more ready for labor than if you didn't take the dates. And a lot of these in the studies, you'll find that they decrease C-sections, which is ultimately what I'm talking to you all about this for. It's not to kickstart you into labor, but it's hopefully kind of priming your cervix so that when labor happens or when we need to induce you, it's a little bit more ready. Now with the dates, you again need to start at about 36 weeks and people were eating 6 dates a day. Now, this is not gonna be great if you're diabetic because dates have a lot of different kinds of sugar, something you need to be aware of. This is not gonna be great if you hate the taste of dates or the texture of dates, and I hear that a lot. Some people put peanut butter in them, which I think is actually a really great snack, might be a great way to eat them if you are diabetic. Some people just put them in smoothies. I have recipes in my post if you're looking for different ways to get dates in. The idea is that there's some compound in dates that helps start up a prostaglandin. I don't really know how it works, but I do know that the studies are pretty firm on that one. The other good thing about dates is if you are having any constipation, dried fruit is often a remedy for that, might help you not poop at delivery, and if you were to continue eating those dates, it might even help that first poop after delivery be even better. That is a real problem point, I gotta tell you. Okay, so those are the 4 things, but I do have a few more things that I recommend that you're doing in those last few months of pregnancy so that you can help your body be ready for labor. The first one is to make sure that you're getting prepared. Did you know that you might be stopping the flow of oxytocin because you are afraid of the hospital, you are afraid of birth? I do not want that for you. It is possible to get prepared for birth in the online prenatal class for couples. Now, there's lots of different birth classes out there, but I want to caution you that a recent study showed that many of them fall short of talking about interventions. We're talking about things like C-sections, inductions, like 5 nurses running your room because a baby's heart rate goes down, which happens pretty frequently, and most patients have that happen to them. And I hate that it's traumatic, but also as a labor and delivery nurse, if something really is going wrong, we love to have many hands in the room right when we need them. Also, I find that there are a lot of birth classes that feel like there is one right way to birth. So I would encourage you to make sure that you're taking a birth class that gives you an unbiased viewpoint of the data, helps you to make choices for yourself during that time, and you don't end up having your birth with another birth of guilt, because a lot of them, you end up feeling guilty because you got an epidural, end up feeling guilty because you got induced, and I just don't think that that's helping anybody or is appropriate at all. I often hear in my comment section, I would never do that. Like, I would never allow them to do forceps. And I promise you that person, given a specific circumstance, would allow them to do XYZ. That's just how pregnancy goes. So make sure that you're taking a class that's unbiased and can really help you get prepared for birth. I recommend the online prenatal class for couples, but there are lots of good birth classes out there, and I would encourage you to check them out. Another thing I'm really recommending people do is to work your hips, baby. And I'm not talking about the smexy time that we were talking about at the beginning of this video. I'm talking about getting into deep squats, really helping those ligaments open up. So many of us are just sitting in chairs. Now, if you have a job where you're squatting frequently, then huzzah, that job is prepping your body for you. But if you're in a chair a lot of the time, you really need to get those hips prepared and in a way that can help the baby come down. In fact, I read an article on birth trauma a while ago, or a study, and they showed that people who exercise were less likely to have birth trauma. And part of that, I think, is because they're less likely to have a traumatic birth because they have so much movement in their lives. So I would just recommend finding a video that helps you get into that deep squat. I know videos that I took, they really got us into that deep squat, which a lot of times I'd use my couch behind me because I am tipsy in a deep squat. And then they'd really encourage you to deep breathe and open up that pelvic floor, which is a great practice getting ready for birth. Quick reminder that while I think birth classes are not just about breathing, I do think that natural pain management is super important to learn about in a birth class. The final thing I'm going to talk about is perineal massage. And again, I don't know why providers aren't talking about all these different things while they're in the office. Perineal massage has been shown to decrease the larger tears. So that's a 3rd and a 4th degree. And I am telling you, as a person who had like a 3rd to 4th degree tear, the difference between healing from a 3rd to 4th degree tear versus a 2nd degree tear is night and day. So the more that you can do to get ready for that, I totally recommend. I have a whole article that's included in the link below, but I would encourage you to talk with your provider, see if it's right for you, because it's not right for anybody. If you have any varicose veins down there, that's not something that you're going to want to be doing. And as a quick note, you are not going to want to be doing these things if you are planning on a C-section. If your placenta is in the way, or you have some other big issue as to why your cervix should not be opening and trying for labor, you should not be trying these things at home. And really, there is no reason to try them at home because it's ultimately just trying to prime your cervix for a vaginal delivery. So I hope you found these helpful, these 4 different things to get your cervix ready to prepare for labor. Just to review them, they are smexy time with your partner, pumping or stimulation in that area, primrose oil, and dates. So if you have any questions, be sure and read that whole article down below. It has the studies link, so if your provider gives you a big fat eye roll, you can come up with the studies that really show that these things could help, just in case you need an induction, or when you go into labor, it might make things a little bit easier. Please come find me in the online prenatal class for couples. It is the easy way to get prepared for birth. It is unbiased, taught by an expert, and the price point is going to make your wallet happy. We'll see you there.